Welcome to the bottom of the scrub bin. We are Lauren and Pam, nurses by training, pharma by accident, and moms by pure chaos. We've cleaned up the messes in hospitals, in drug safety, and in life, so now we're talking about them. Grab your coffee, your scrub top, or whatever's at the bottom of your own bin, because we're digging in. Hi everyone, and welcome back to Bottom of the Scrub Bin. Grab your coffee and let's get started. Today we're talking about Botox, skincare, and all things that come with it. And I'll be honest, this is something I was personally ill-informed about and really nervous about. Have you ever felt curious about trying something but also scared at the same time? Like, do you want to take care of your skin? You want to feel good, but you don't want to overdo it, make the wrong choice, or walk out looking like a completely different person. There's so much information out there, and not all of it is helpful. So today, we're breaking it down, asking all the hard questions, and talking through what you actually need to know before you book your first appointment.
Today, we're joined by Julia, a nurse practitioner with over a decade of nursing experience and a strong focus in aesthetic medicine and wellness. She brings a deep understanding of the physiology of aging and is known for helping patients achieve natural, restorative results, really focusing on enhancing, not changing who you are. Julia earned her degree in biological sciences from NC State before completing her bachelor's, master's, and doctorate in nursing at Duke University. She's been practicing as a nurse practitioner since 2017 with a background in procedural and surgical settings that really translates into the work she does today as an aesthetic injector. In addition to her clinical work, she also serves as an adjunct faculty member at Duke University School of Nursing, where she's helping mentor and shape future nurses. She's also a wife and a mom of two, so she truly understands the balance of taking care of everyone else while still wanting to feel like yourself. And on a personal note, I've actually interviewed multiple aesthetic injectors, as Julia knows, and she is the only one I trust to touch my face. So that should tell you everything you need to know. So Julia, I am so glad to have you here.
Thank you so much. I can't believe that's me that you
It's impressive.
it feels
I'm
like
not gonna
it, but
lie.
it doesn't. Like, I'm still in college and on a beach somewhere working a summer job, but I guess that's me.
That is you, and we are impressed.
Yes, I'm glad to have you.
Yes, before we dive in, we're bringing back our mugshot segment where our guests show us what they're sipping on and the mug that came with it. So Julia, what'd you bring?
I have this Yeti mug.
I love a
And
Yeti.
it's full of water because I need to drink water. Everyone needs to drink water, and I was running late. But my very good friend, Erica Shaw, who's an awesome primary care physician, got me this when I had a fresh baby, my first daughter during the pandemic. I was
Oh,
still working in the hospital
Oh
for
my
transplant surgery,
oh wow.
and I was just struggling in lots of ways, but I could never get through my first cup of coffee. So she too had a newborn, and she showed up one day at my doorstep with this gift and said, like, you got this. And so
I love
Aw.
it.
that was part of like my evolution into the new world of medicine I work in.
Mhm.
And so it felt appropriate.
I love that. Yes, and that's great for nurses, right? Keeps your coffee warm, and then the
Yeah.
new
Yes.
moms.
Any
Yes.
new moms. I think that
Right.
should be a standard from here on
Yeah.
out.
Right.
Yep.
Right.
Yeti with a lid, so you
Right.
don't feel like,
Yes.
what is happening?
All
Right.
down the front of you. Yeah.
Yes.
But water.
I love it. All right, guys. Well, now that we're settled in, let's get into it. Julia, I actually want to start with the basics here because before anyone even thinks about treatments or injectables, I feel like there's a lot of confusion around just everyday skincare.
Mhm.
And even before that, I think people hear terms like esthetician and don't always know what that actually means. So, can you start by explaining what an esthetician is and the role they play? And then for someone at home trying to take better care of their skin, where should they even start? What are the absolute basics everyone should be doing at home?
Yeah, so estheticians are licensed individuals who can perform procedures, but are typically like your skincare, skin health gurus. So
Okay.
facials, lasers, microneedlings, assessments. They sometimes work in a like true spa environment or a med spa environment like I do, but it's a licensed esthetician licensure. So they could do anything from massage or hair and nails. And it's people that further their training to become more like medical estheticians, which isn't a real licensure requirement, but it's kind of a field, a job training.
Sure.
I consider myself an aesthetic provider, which would not be an esthetician.
Okay.
So as an injector, you can be a nurse, you could be a NP, you can be a PA, you can be a doctor of any kind. You have to be a licensed individual to inject medications, which is what Botox is. And so in North Carolina, that's not within the scope of practice of an esthetician, but in some states across the country, and I know you have listeners everywhere, estheticians may be able to inject.
So if you have a nursing license, do you have to have that additional esthetician license as well, or is it kind of covered under?
It's under your nursing degree and part of your scope of practice under, of course, a supervising sort of practitioner or something. But yeah, it's not actually an additional certification, which is, I think, crazy because it's needles in your face.
Yeah.
Right. And I think as a consumer, not realizing that anyone with a certain baseline degree could do this.
Right.
But how were they trained and how did they come to be able to do this skill or acquire the medication to inject is like more behind the scenes stuff that you just don't think about as a patient.
Yeah.
Right. And I think that's why I was so paranoid when I did my interviewing.
Rightly so.
And what to do at home foundationally. I'm a really big proponent of if you don't have something to take care of your skin at home, even if it's a very basic routine, it's like going to the dentist for your deep cleans and then not brushing your teeth every day.
Okay.
Yeah.
And so the injectable appointments are only every few months and they're very expensive. And you want to support that investment the best way you can.
Okay.
And also, it's so much more the skin health now than just freezing the muscles underneath your skin.
Yeah.
So foundationally, everyone should try to wash their face twice a day.
Twice a day. Okay.
Okay.
It does not have to be like a crazy expensive face wash, but you definitely want to know what kind of skin you have to know what kind of wash you need. Like some people need a very mild, gentle cleanser. Some people need something more exfoliating with an acid. But there's really decent over-the-counter options now. I think, don't go straight to TikTok shop for your advice, but there's a lot for consumers to consider, but that's also pretty overwhelming.
Yeah.
But foundationally, twice a day face wash, sunscreen in the morning. If you're not doing that, like pause this podcast and start there and then come back. Right?
Yeah.
Yeah.
Very important. If there are any questions about what type of skin you have, whether it be oily or dry or flaky, is that something, Julia, you would be able to help out with? Like somebody could come to you and you could advise what skincare products, or would they have to see more of like a dermatologist for that?
So I think you could go either way. If you're already seeing a dermatologist, a medical dermatologist for routine skin checks, which I absolutely recommend to everyone. They can help guide you on your skin typing. But most med spas either have a practitioner like myself or an esthetician who can do just general aesthetics consults or skin analyses. There's lots of great objective tools out there too that scan your face and compare you against cohorts. Some of them are AI driven, some of them are not, to just back up the subjective assessment that we would give.
Yeah, that's really interesting.
But typically, just a general consult at most med spas is a great place to start. And a lot of them, whatever the fee may be, goes towards either products or services. That's pretty standard. And just if you did something like that, taking a little inventory of all the supplies you have at home, if you have face washes or some over-the-counter sunscreens or vitamin C's or over-the-counter retinols, any prescription topicals, bring those with you when you go,
Okay.
because it's so helpful to kind of build a plan around what you may have or what you should edit out.
Okay. So do you think, that kind of goes into my question, do you think, is there really a difference between drugstore products and what you get at places like, Sephora or Ulta versus a med spa?
I think absolutely.
Okay.
Most medical grade skincare lines have white papers and studies to support their products. So if you're at a drugstore and you're looking at like night creams,
Uh-huh.
and there's like an Olay night cream with some sort of retinoid in it,
Uh-huh.
that is not going to be as potent as a medical grade retinol or
Okay.
retinoid prescription. And that's just because you can't safely have those products stocked on a shelf for anyone to pick up at a drugstore.
Right.
And so even though the price point may be half or even a quarter, you're going to have a quarter as effective of a product. It's going to be just a safer for all.
Yes.
And sometimes they use things like alcohols as drivers, so that if you have more sensitive skin, could put you in a position where you're like inflamed and not getting results. And so I do think that there's a lot of reason to consider medical grade products.
Okay.
Or really like upstanding over the counter.
Okay.
But typically Sephora's and Ulta's or department stores have this more luxury skincare. And again, they may be nicer experiences than what you can get from CVS, but that doesn't necessarily make them better.
Okay.
So absolutely, I support medical grade skincare because you truly get what you pay for.
Okay.
Yeah, there's all that science backing it up.
Yeah, and if you're going to spend the time, especially if you're a busy working mom, don't want to be taking the 5 minutes out of your evening or morning, which is usually all it is, putting things on that just aren't getting you the results you want.
Right.
Right? Like that 10 minutes adds up.
Yes.
You want to see results.
Yes.
Right. So you mentioned the alcohol. Are there any ingredients people should actually be looking for in labels to include or avoid?
Not necessarily. I think it goes back to what is your skin type, what are your skin goals, what are your skin needs, and then yes, you may want to specifically avoid certain things. Like if you're a very dry person, you typically would want to avoid anything alcohol, which is called many different, chemical versions of alcohol, because that would just further dry your skin.
Okay.
Some people that are more acne prone would want to avoid known comedogenic agents, which can congest pores. And there's so much out there about skincare now that you can generally Google or ask ChatGPT or AI like anything about a product or Reddit and get some sort of feedback there. But I don't think there's anything truly unsafe.
Okay.
Blanket.
It just depends on your particular skin type. And you said the ones that may irritate the acne. Are there any specific examples of those ingredients? I know you gave the overall blanket name, but are there any examples?
So anything that's gonna feel like a thick barrier could potentially have ingredients in there that just block those pores and congest those pores, like the beef tallow craze. There's a lot in there.
It's all over.
Yes.
And we probably will get to that later, but there's a lot of stuff shoved into these products, maybe unnecessarily to keep them stable or like in a nice consistency that serve your skin truly no benefit. So
gotcha. Yeah,
I don't
that's
have
good to know.
a specific 1 or 2 ingredients off the top of my head, but
no worries. I know I have really dry skin, and for the longest time, I didn't know a lot of these products contained, alcohol because I was unfamiliar with the specific scientific name attributed to it. So I'm sitting here just drying out my skin and seeing these red patches everywhere until it kind of clicked that, hey, this contains alcohol. So Julia, what are the biggest mistakes you see people making with their skincare at home?
I think the biggest problem is not giving things a long enough time
Okay.
Mhm. I'm
and
guilty of that.
and weaving in too many things. So
Mm-hmm.
a skin cell cycle, so like think of a new skin cell in your basement layer coming all the way up to the surface and sloughing off, is like 6 to 8 weeks minimum.
Oh, wow. I
So
was
if you're
thinking like
not,
a week.
so if it sometimes feels that way, the way our
Yeah.
skin is so reactive,
Mm-hmm.
but if you aren't giving something a really good college try,
hmm
I don't think you can say you've tried and failed a product.
Yeah.
I think I'm guilty of that one as well. It's the patience, right? Like you want to see results so quickly.
Right.
And then when
Mm-hmm.
you don't after 2 weeks, it's like, well, why am I wasting my time? But to hear
And
that, it
behavior
takes
change
that
is
long.
hard.
hmm
Yeah.
Right. It is. hmm
Yes.
Like, how long is truly a behavior change going to stick and then be a habit?
Right.
hmm Right.
So, you want to see results quick.
Mm-hmm.
You don't want to have downtime to get results, but truly giving something like 2 to 3 months is my best recommendation. And for me, that's usually the interval at which I see my patients back every 3 to 4 months. So,
hmm
I really can say, like, hey, how's it going with this new product you tried or something like
hmm
that.
Yeah.
Yeah. So you kind of mentioned this, kind of answered this, but is there a way for people to have too many products or too many steps in their regimen?
Yeah, I think I'm guilty of that. And it's like such a lovely problem to have that we have so many amazing product lines and so many amazing supportive reps that provide us all of the new things to try. And sometimes I get overwhelmed and I'm like, I don't even need this step. What's going on?
Yeah.
But then there's this other trend of skin flooding
Oh,
where you just layer and layer and layer and layer and layer till like your skin can't handle anymore. And I don't
Uh-huh.
really think there's a lot of evidence backing that, but I think realistically, if you can get multi-use products, like something that can tighten and brighten or
Okay.
help control acne but also be anti-aging, or is not an eye cream but is safe for the eye tissue, like I think consolidating and making it easy for to be consistent is what I try to recommend.
Yeah, I'm definitely guilty of the flooding. I know I put one
Yeah,
product after another all over my face. I don't know which one's getting absorbed or which one's
yeah.
working.
Or like how to layer.
Yeah, that's really
How to
important.
layer skincare is something too that like so beneficial to learn from an aesthetic provider
Okay.
on what to do to not waste your money. So the things that
right.
need to be absorbed first are.
And are we mixing stuff that shouldn't be mixed too, you know?
Yeah. So sometimes it's like this has a pH of this, this doesn't. You don't want it to neutralize. Typically, the rule, if this is helpful for your listeners, is something that's prescription, like a tretinoin, or if you have rosacea and you have like an azelaic acid,
Mm-hmm.
something that needs to be potently delivered as more of a medicine goes on first,
Okay.
Okay.
and then thinnest to thickest
Okay.
Okay.
thereafter. Like if you're like, what do I do?
Yeah,
Yeah.
that's where I
That is a
am.
good rule of thumb to start there.
No, that's really good to know, and that's really helpful. Something that
Right.
small could make a big difference.
Yeah.
Yeah.
Right. So should skincare change with age and hormones? I mean, I think I know the answer to this, but
Okay, absolutely. I think skincare should change throughout different seasons of the year.
Mm-hmm.
So yes, I think the reason why you trust me, Pam, and
Mhm,
other people trust me is that I really pay attention to like you holistically
mhm,
and what's going on. I also do some of those wellness services. So as you can imagine, I like to age with my aging population, and most of my demographic is like 30, 40, 50. And like
mhm,
what happens then?
Yeah.
mhm,
Like very big moment in our lives. And
Yes.
also like recovering postpartum. Like I get to deal with this very transient season
mhm.
for women. And so things change all the time.
Yes.
Some things are not safe during pregnancy or
Mhm,
not studied during pregnancy, maybe safe, but not studied.
Mm-hmm.
And so people's skincare regimens and what they do tend to shift during that period as well. So
Okay.
yeah, you definitely want to be with someone who longitudinally can help you.
Yeah.
Mhm.
And
Yes.
like if you tried an eye cream and you're like, I hate this, I got dermatitis of my eye, my eye's irritated. It's my job to remember that. So
Okay.
like when a new product comes out, if it has an ingredient that could overlap, I would not want to recommend that to you and put you through
Mhm.
something like that again. So for sure.
Okay. That is helpful. And I think, once people feel good about their routine, the next question naturally becomes, what else is out there? And for me, that's where a little bit of fear came in, as you know, especially when it came to injectables. And so going back to when we first met, Julia, to just let all of our listeners know how terrified I was, I interviewed so many estheticians, finally got to Julia.
So
And
lucky it was me.
and then I walked in and I had, I don't know, a million questions, right? I think it was, what happens if I have an allergic reaction or anaphylactic shock, or what happens if part of my face falls, or all the fears that I think a lot of people have.
Mm-hmm.
And so Julia finally just goes, sit back. And she put one unit in my forehead right here. And she's like, come back in 2 weeks and we'll fix it if you don't have a reaction.
A little test spot.
A little
Yeah.
test spot. And it was just, that was enough for me. Of course, I had this beautiful dot right here after 2 weeks, by the way. And I went and just finished it. But yeah, you just made me feel so comfortable. And the fact that you were able to even talk me through, not even just what happens during my fears of being allergic or having an allergic reaction, but being able to tell me and name the muscles and how it all works, it was just so helpful for me. So for our listeners, just make sure you go in, have your questions ready, and you have to feel comfortable with that person putting Botox in your face.
Yeah, it's so important.
Mm-hmm.
Well, thanks for trusting me, Pam.
Yes.
It's
So,
been a true pleasure to be your patient and friend for a few years.
yes, I know.
But if you have questions that cannot be answered,
Mm-hmm.
it's medicine.
Mm-hmm.
Like you would not be put on an antibiotic and your doctor not know how to explain the why or the side effects
Right.
or how it works to you.
Mm-hmm.
And this is just the same.
Yeah.
So if you
Yes.
have unanswered questions, as
Mm-hmm.
long as it's a reasonable question, I don't know, it wouldn't be like that's not the
Right.
person for you.
And there's quite a few people that I walked away from because they couldn't answer even basic questions. It was a red flag for me. So
Or
I
even
said, no, no.
disregarded your questions, right,
Right.
Pam? I know we
Right.
talked about that
Mm-hmm.
Yeah,
several times.
that's no one should feel that way.
Right.
And it's also expensive.
Yes.
So
Right.
you should have the full experience.
Mm-hmm. Right.
Whatever that is to you is what you should have.
Yes. So going into that, what are I know, I told my story, but what are the most common fears you hear from patients? Is it the same thing that I came in and asked, or what would you say?
Gosh, there's probably a million.
I would be that one coming in. Is it going to hurt? It's a needle.
Yeah. Yeah. So
Yeah.
let's start by saying I always book a follow-up if it's a first timer.
Mm-hmm.
And almost every time someone comes for a follow-up, they say, I don't know why I didn't do this sooner. Or like,
me.
I don't know what I was worried about. So like normalize that.
Mm-hmm.
It's needles. They're super small, but they're in your face.
Yeah.
Right.
So a lot of people are worried about comfort. What's it
Mhm.
going to feel like? And honestly, if you treat multiple different areas, they all kind of feel a little different.
They do. Mm-hmm.
And I think the first time someone gets treated, they pay such close attention to it.
Mm-hmm.
They want to know when they'll see results, and it's not immediately, which is
Okay.
also a little bit anxiety provoking for everyone.
Yeah.
Sometimes me, even, I can't tell you how many times I've injected someone's face at this point, but everyone's anatomy is so different, and every once in a while I'll just close my eyes and think about you at night, like, oh, I hope I
Yeah.
could do perfectly.
We
But
joke
it's-
about that too. Pam and I were just talking about that the other day. Like, I don't know that I could be responsible for that. So
Yeah,
kudos to those
and
providers.
they just want to know like how they'll feel, how they'll look.
Mhm.
how long it will last, and all of those things are really uncertain, right? I
Yeah.
can't make any guarantees there. So I just have to tell them I conservatively treat the first time. I try to explain people's various anatomies so they feel more confident that this very uncertain outcome is going to be perfect. And there's no reversal agent, right? So people are like, well, what if I don't love it? I'll just say it'll be gone in 3 to 4 months.
Right.
And
Yeah.
that has never happened, except sometimes people just feel uncomfortable with certain very, more intense lower face treatments. But as far as the normal Botox you think of to smooth a forehead, you can always add more to correct. You can't take away. And like volunteering yourself as an injector, and if someone's not offering you a follow-up, I would definitely push them on that.
Okay.
Because as experience and knowledge and understanding of the medicine and how to dose it, I'm still shocked sometimes in that I maybe underdosed someone, but I'd always rather underdose than
Right.
overdo it and someone
Yeah.
feel too heavy or
Yeah.
Right.
So
I
you want it to feel
remember.
natural, right?
yeah.
Yeah. And I remember my first time, it is an adjustment to get used to how it feels in your face.
Oh, I bet.
But it's also funny how, the first time you go, and Julia, maybe you can say a lot of people are like this. They're like, just a little, I just want a little bit, like just
Yeah.
a little bit. But then by the time I came back the second time, I was like, light it up, girl.
Yeah, I'm pretty sure
Get
you
it.
came into my chair and you were just like,
Let's do this.
I was like, what the heck, Pam? You put me through all of this the last time, and like, see, I told you.
That
But
second time, I was like, I'm moving again. Light it up.
I love that. And truly, the reason I love my job is I kind of only have to convince you one time.
Mm-hmm.
And then when you come the next time, we get to catch up. We get to
Yes.
talk about your family.
Right.
I could really do your full face in 60 seconds. I'm pretty quick. Not rushing, but it's like 25 minutes of social hour.
It is.
And then like 5 minutes of getting to
Right.
business. And
It's
like
true.
that is the most rewarding part for me.
That's awesome.
Yeah.
Yeah.
So what would you say to someone who is worried about looking frozen or unnatural, like I was the first time?
It's definitely product and dose dependent outcomes.
Okay.
So there's many neurotoxins on the market. There's not just Botox. There's Botox, Dysport, Xeomin, Jeuveau, Daxxify, Latibo, and maybe that's it. At present, was that 7? So any injector may have a different combination of those products to offer you. And so it's just like if you had high blood pressure, I could choose of the same class of beta blockers, how many different options.
Right.
And usually it's a provider preference.
Okay.
Or business preference. That's like the first layer. But then I think most companies try to have a variety of potencies or profiles for a more natural versus a more frozen look.
Okay.
I think, but most people are moving towards, I want to look natural. I don't want people to know I've had anything done.
Right.
And a really skilled injector can achieve that outcome with almost any product, right? But that takes critical thinking and judgment on dosing. But dose is duration too. So you never want to underdose someone for a more natural look and feel and it not last a full 3 months. That's not fiscally responsible.
Right.
So then like choosing a different product would be the more appropriate thing.
Okay. Because I know, I keep saying Botox, but I actually do Xeomin just because that works
It's
better for, right.
It was better for you because you were worried.
Because
And Xeomin is a purified toxin. So a lot of like unnecessary parts to it have been sieved off in manufacturing, and that felt right for Pam.
yes.
But may not be right for you, Lauren.
Right. No, I need the high dose stuff.
High test. Premium.
Yeah, premium.
Xeomin's a wonderful toxin. I'm not saying that, but no.
So I guess maybe we should have started with this, but that's okay. At a high level, can you tell people what these neuromodulators are actually doing to your muscles?
Sure. So your nerve muscle junction is this little like space where your body, when your muscle wants to contract, releases acetylcholine and then it binds on this snap receptor. So, like, really biochemical situation.
Yeah.
So, every time your brain tries to tell your muscle to contract, this happens. The way that a neuromodulator works or neurotoxin is that muscle is injected with the medicine binds at that receptor site and blocks the
Okay.
release and the uptake.
Okay.
And so it temporarily binds. Some bind in different ways based on accessory proteins or peptides. They're all kind of a little bit different. That's how there can be so many different brands on the market. But they bind until your body metabolizes that drug away and then they break off.
Okay.
And so you want to make sure you're getting all of that medicine into the muscle.
Okay.
But inevitably, some of it could just wash out into your bloodstream if it doesn't bind super well based on injection depth or just if it was located near a blood vessel, right? So some people will say, "Oh, I bruise all the time with my current injector." And that worries me because I worry that that's like medicine flushing down the toilet,
Right. Yeah.
being injected into or like infusing through the blood vessel and not into the belly of the muscle.
Okay.
This is so super complicated.
It's like,
It's really cool though.
yeah. And I think
Yeah.
that's what is the misconception in our society that, oh, it's just Botox.
Right.
Right.
Which, like, it could be, I guess.
Yeah.
You have a complication.
No, you guys are chemists behind the scene here.
Right.
Yeah.
Yeah.
Mhm. When do you see people typically start considering them?
I believe that if you wear a full foundation, some sort of makeup,
Mm-hmm.
and that makeup settles in lines, static lines, immediately, not at the end of the day or the end of the night, it's time to
Mhm.
consider.
Okay.
Gotcha.
Because then you can still have your skin repair without needing additional modalities of treatments to really resurface those etched in lines.
Mhm.
Okay.
So it's a little different for everyone. And I think it's very different if you like have a child earlier in life or you have a dramatic weight loss or some sort of like sentinel event that accelerated your aging.
Mm-hmm.
But typically like late 20s, 30s
Okay.
is the soonest I would recommend someone consider.
So I was late to the game. Got it.
Your anatomy is different than like I had deep, deep, deep lines at like 28, 29. And
Right.
it's just
Yeah.
different
Different.
skin, different ethnicities.
Right. And so once you start, do you have to keep doing it?
It is a finite medicine.
Mhm.
So if you want that outcome, you have to continue to get that medication administered.
Okay.
But there are other things you can do to either stretch out interval or improve your skin quality in other ways.
Okay.
How often do people typically have to come back? Is it a 3-4 month thing? Is it a 6 month thing? Is it a couple weeks?
I try to get everyone on a 4-month interval, which is three
Okay.
times a year. If you open up a insert, it says 90 days, right? But
Yep.
Okay.
that doesn't have to be. If someone like runs marathons or hot yogas, they're typically not going to have as good as a duration as their counterparts that don't do those things.
Okay. Good to know.
And that's because when they work out that much, they metabolize it faster. Is that how that works?
It's
Mhm.
a metabolism thing. Yeah.
Okay.
And sometimes when you're, new to me and I don't necessarily tweeze all those things out,
Mhm.
or even if you don't do that and you just have a really crazy metabolism, I guess for a 3 to 4 month interval. But if you come and it's like 3 months and it's totally back to baseline, then we
Mhm.
just either dose heavier or know that that's your interval, and that's okay.
Okay.
So that's
I
why
think
it's
that's
important to follow up.
right.
Totally. I like to pre-book
Okay.
that
Yeah.
time
Mhm.
so you at least have a calendar reminder of like, oh, I should start paying attention to my face and seeing what's happening because I think when it's your first time and you're watching every little movement kick in and you're so fixated on it, you like just forget. And then you're like, this is my new normal.
Yeah.
And I've had a lot of people come for that first follow-up like too soon because they're like, look at all this movement. And then I pull up their original photo and it's like nowhere near that. And it's just this change in perspective of
Yeah.
this is the way I look and feel.
Mm-hmm.
Yeah.
And it usually just takes truly like the whole year, would you say, Pam, to like
Mhm.
figure out what your interval is and the dose, and then we just like keep it going.
Right. Yeah. And then when you go in, like you said, it just takes no time at all because you know what we've
Yeah.
done, what my dosage is.
And that brings up a good point to not like hop around for Botox specials,
Mm-hmm.
like for that reason. So it'll be like starting from square one every single time.
And you
Right.
know, I wouldn't do that anyways because
No, you would not do that, Pam. I
no.
would be on this podcast.
I'm way, listen, so anybody looking at my forehead now, I'm way overdue, but that's because Lauren and I decided to leave our jobs for a little bit,
Yes.
start
Well.
a business.
And a podcast.
Yeah, and a podcast. But
Good
I'll
thing
be
you know
back.
someone
I will
who
be back
does it.
shortly. That's funny. All right. So, what's the difference between subtle and overdone, and how does that happen? Is it the request of the patient? Is it the injector, or both?
I think it's probably both.
Mhm.
I think it's really hard to say no in a cash pay environment
Mm.
where it's a sensitive body image and confidence conversation, right?
Mhm.
So like what you think you should look like and what I think you should look like needs to meet in the middle.
Mhm.
Right.
But it's really important for injectors to say no. It's a very lucrative business.
Mm-hmm.
And if you are in it for the money, you need to really make sure you're still being ethically responsible
Mhm.
about saying no when you need to say no.
Yes.
Yeah.
I think that comes more with filler than it does with Botox,
Yes.
Right.
which is not necessarily the topic of conversation here, but dermal fillers, I think when people are worried about coming and looking done or overdone, they're thinking of filler, not
Right.
Botox.
I explained that to Matt because Matt was looking at a picture of certain celebrities and he's like, they don't even look the same. Look at all that Botox. And I'm like, that's not Botox.
Yeah.
They've had way too much filler put in their lips or their cheeks and
And
they
that's
look
a
totally
theme.
different.
That's a theme of like partners, people coming and they're worried about their partners.
Mhm.
Like,
I could see that.
are they going to say something or
Mhm.
and I think it's more complicated than like about the way you look. I think
Mhm.
it's about like a financial partnership and I'm spending this money on myself and like probably a
Sure.
little bit of mom guilt if you're a mom.
Yeah.
Mhm.
But most of the time when you come back, they're like, my husband looked at me and he was like, your skin looks nice. Did you get any like lotion or like something? They like can't figure out what it was.
Right.
Uh-huh.
And it's normally that.
Right.
I think celebrities are always under a fine-tooth comb and I think they overdo it a lot
Right.
based on like the societal pressure they live in. And
Right.
normal people don't live in that.
Yeah.
Right.
And there's also lots of really good tools out there now. Aesthetics is really a new field of medicine. Like when I started, we had, I mean, half of the things that are on the market than we have now. And I've only been injecting 5 years full time. So
Oh, wow.
like the whole biostimulator regenerative class of fillers that kind of
Yes.
just spanks your face instead of just temporarily fills and expands tissue. Like that is usually my first line before I grab any like true filler.
Okay.
Mhm.
So that keeps people looking so much more like themselves and normal because it's their own body
Mm-hmm.
making these rejuvenated results.
Right.
You know, you mentioned the husbands. This is kind of side note, but how many women would you say come in where their husbands have no idea they're getting these things done and they pay in cash? And I only ask that because I've seen the funny memes on TikTok. And I'm like, do people really do that?
They do that. Or they put
Wow.
like some on a card, some on cash, some on
Yeah.
another card. Yeah. Or like I asked my husband for a facial gift card for the med spa,
Oh.
and he thinks
Okay.
I'm getting facials.
Right.
Oh.
And that makes me really sad
Yes. I mean, Matt would not care. He's like, whatever.
because like I'm so fortunate that
Mhm.
my husband, I'm a Gemini, he's a Sagittarius. He's like so easygoing. Like he'll ask me sometimes if he can get something on Amazon, and I'm like, "Do you know how many things I got on Amazon?" And I
Right.
totally didn't even think about you, Dan.
Right.
Right.
But if someone, woman or man, wants to do something to feel better about themselves,
Mhm.
they should be able to do that without worry
Right.
of anyone
Or
questioning what
judgment.
that is.
Yeah.
1000%.
If it's
Yeah.
getting your nails done,
Mhm.
if it's walking in a park, if
Mhm.
it's getting a massage, or if it's doing this, buying new makeup, buying a lipstick, getting a blowout, like it's whatever you need, and it should not be anyone else's judgment. I think it's more of like that financial influence piece,
Right.
Right.
Yeah.
which I
Mhm.
get. I mean,
Mm-hmm.
even if you don't have a budget, there's a budget somewhere.
Right. Yeah.
And so I always try to respect that
Mhm.
regardless of who it is.
Right.
Yeah.
I
But
do
then
love that
sometimes,
about you is that
yeah,
when anytime I ever go, you're very upfront about cost. You're like, this is what this will cost,
yeah.
and you're not pushy. And I think that's huge. But that kind of goes into my next question.
Yeah.
What should people look for when choosing an injector, and what kind of red flags should they watch out for? And I only ask because we keep bringing up the things that are the reasons why I chose you as an injector.
Yeah. I don't think that title matters, meaning I don't think that a physician or a plastic surgeon is necessarily better credentialed or better for you than an LPN or a licensed practical nurse. I think it's
Okay.
truly their knowledge base, what kind of experience they have, if they have before and afters to share, and just like a trust factor.
Mm-hmm.
Like how would you choose a primary care provider, or how would you choose a hairstylist? There's going to be some component of like, do I relate and feel comfortable with this person?
Mm-hmm.
Word of mouth is the best referral source I have, but that takes time too.
Mm-hmm.
Right.
So I mean, Instagram is a really big way we market ourselves as injectors. And typically, if people are willing, patients are willing to share their before and afters, with which unfortunately does not happen enough. That is a good way to kind of see the results they're doing,
Okay.
Okay.
especially for filler, right? So,
Yeah.
like if you see that filler face that looks not like a person,
Mm-hmm.
that would be a red flag for me. Like, I don't want that person to do my filler.
Right.
Mm-hmm.
But Google reviews, I mean, how did you find me, Pam? Do you know?
I don't remember. I think it was just, well, I had
Just
been to quite a few med spas. I think that was the thing. I had been to quite a few med spas and interviewed, did not like their answers, or they couldn't answer my questions. And I don't even think I actually seeked you out. I think I just
Yeah.
found the place you were working at, and you happened to have an opening when I was able to come. And so it was by fate.
Yeah. I mean, we truly appreciate like a Google review,
Mm-hmm.
Yeah.
specifically naming a reason why, and that has carried me a long way, and word
Yeah.
of mouth.
Mm-hmm.
I know I'm
I
that
don't know if that
paranoid
answers
person
the
that goes onto Google and reads all the reviews, starting
question. Yeah.
with the poor ones to the excellent
Yes.
ones.
I like the mid-range ones. I
Yeah,
like a
that are
3. I
honest.
like a 3
Yeah.
because they're gonna give not like a super extreme. I think those are the
Right.
most,
Yeah.
but
Right.
there's not like a database. Some people have made them. Like if you deep dive through Reddit or like different influencers on Instagram,
Mm-hmm.
they have people on lists. And I'm actually on a list.
Mm-hmm.
And I did it. I was like, how did you find me? Welcome to the med spa. And they're like, oh, this influencer sent me your name. And I was like, what did you just say? So I think
Really?
like asking how someone found you
Yeah.
is the most helpful thing, because then you know what
Yeah.
avenues people are actually sharing. But
Right.
I think more so now than ever, women are talking about this.
It
I don't
used to
think
be
it does pressure.
taboo, right? Like you didn't tell
Yes, you
people, but
don't
now it's
talk.
like,
Yeah.
Yeah.
So
mhm.
ask your friends. If someone's looking good and they're not talking about why they're looking good, I think you have every right to go up and say, "You look so great. Would you mind sharing with me what
Mhm.
you're doing?"
Yeah.
Don't gatekeep.
Don't gatekeep. We don't
Yes.
like that. Lauren and I don't
No.
like that.
We all win. If one of us wins, we all win.
Right.
And I
Right.
have to say, I do love following you on Instagram. I do.
Okay.
Yes.
Yeah.
I've had to like glue my hands down whenever content is made of me because the way that it gets cut together, I look like I'm a flight attendant.
No.
And I'm like, ugh, I can't even with myself.
That's usually me. I'm usually sitting here talking with my hands flying
Yeah.
all over the place.
Yeah. Ugh. If I could just put my hands in my pockets for life.
Right. What do you say to somebody if they ask, is it okay to say no during a consultation? Like I didn't like the way they answered and I just said, thanks, have a nice day. Is
Yeah.
that okay?
It's totally okay. I would feel better about that than someone not feeling comfortable with me because then I think it's an uphill battle the whole
Mhm.
time,
Yeah.
right? So
Mhm.
in my consults, I typically like price out everything and come up with a 12-month plan of all the other various things you could do based on your concerns. And would you like me to do anything today? Would you like to pre-book? Do you want to think about it? Like message me on Instagram if you have more questions or text the office. I think it's very important to not put pressure right in that moment at a consult to treat.
Mhm.
Yeah.
Typically, consults are often built to allow time for that. And you can always ask if you're booking, like, if I decide to get treatment same day, would that allow for it?
Mhm.
And then you, if it's brand new to you, you can better prepare yourself for, like, oh, I'm going to do this.
Mhm.
Right.
I think it's a big, like, oh my gosh, it's this procedure with needles, it's this big amount of
Mhm.
money. I don't know. But if you have, like, an event, like if you're a bride and getting married, like you need to come a year before your wedding
Mm.
so we can figure it all out and feel
Right.
comfortable and you don't have any worries.
Yeah.
Okay.
No, I appreciate that because I'm the person that sits there, soaks in all the information, and then kind of it takes me a day or two to kind of mull that information over before I make a
Yeah.
decision. So, not having it pushed on you immediately, but giving you the option should you want to have it done right then and there. I think that's
Mhm.
really
Yeah.
important.
Even if it
Yeah.
is one little unit, right?
One little unit, yes.
I don't even think I charge you for that unit.
No,
I think I was kind of like,
you were like,
okay, lady needs to go. No, I think
you probably were with all my questions.
we did the absolute right thing for you,
Mhm.
but I've got to say I've never done that for anyone else.
Right.
Look at
Like,
that, Pam. You're one in a
I was
million.
like, you know what? I think I said, I appreciate you actually being worried about this. If you weren't
Mhm.
worried, I'd be worried
Yeah.
because
No,
it's medicine and people just don't like make that connection all the time.
right.
Yeah.
Well, the industry that Lauren and I work in too, drug safety, is like,
Yeah.
you see it all.
Yeah.
So you just
Yeah.
gotta, so the paranoia was just like, but it was perfect. I mean, I think Julia like grabbed my forehead and was like, sit back.
Yeah. I might have like
I mean, I
bumped you
approved of it. Don't
and
get me
pushed
wrong.
you back. Yeah. Consent, I touched you and I pushed you down and I put a needle in you.
Right. She's like, come back in 2
Gently.
weeks.
Yes.
Yeah. I think you got a text the next day too.
Yeah.
I think I was
Oh,
like,
I did. You did.
just making sure you're breathing and you still have a face. And,
No anaphylaxis.
No anaphylaxis. Yeah.
but if you did, your injector should have an emergency kit with EpiPen,
Mhm.
all of these emergency supplies, right? So like it's a thing.
Mhm.
I
I
can tell
wouldn't-
you, Julia, the first thing she did coming back from that appointment was call me and tell me,
I did it.
Yeah. How prepared you were.
Oh, well, I wasn't prepared. I just knew my shit.
Yeah.
Yeah, that was it. That's all
Yeah.
it took for me. I'm like, this girl knows what she's talking
Yeah.
about. Okay.
Yep.
Yeah. But then when I asked the anaphylactic question and she had the best response, she's like, I'm going to take care of you. And if I have to, we're across from the hospital. I'll take you over there. I'll drag you over there. I'm like,
Yeah.
okay.
Yeah.
Yeah.
Yeah. I do have mixed opinions about like baby nurses wanting to go right into aesthetics.
Oh, yeah.
Yeah, I could see that.
I could see
And
that.
and if you don't really have that foundational, like even people skill,
Mm-hmm.
Mm-hmm.
time management, complication management, I mean,
Mm-hmm.
I'm so lucky that I'm not a complications expert because I don't like have a lot of them, if any, and I
Mm-hmm.
don't want to. But to know how to really handle that situation,
Yeah. So
I
do
think
I.
it's like really essential that you've got a bit of nursing experience under your belt.
Yeah, I think that's
Yes.
important.
Mm-hmm.
I also think it's really cool that this is, another career option for nurses too, other than, strictly hospital bedside.
Mm-hmm.
Totally.
Yeah.
Yeah.
And I mean, thank you. I think this gives people so much of a better understanding about, what neuromodulators can do and what they can't do and when to use them, when to start them. But when it comes to things like hooded eyes or floppy jowls or a double chin, I think people don't always realize that there are other options beyond that. So if you could just tell us what else is out there and what do you think about those options?
Yeah. So within my current scope of practice, we've got the neuromodulators and then fillers. So the fillers could be hyaluronic acid based or these biostimulator class of drugs.
Okay.
So there's lots to do to spanx or revolumize your face with those. If you need any sort of volume, a machine is not going to do it, right? So machines would be some sort of microneedling
Okay.
with or without radiofrequency energy to heat the tissue, which can stimulate collagen,
Oh.
or lasers. So there's many kinds of lasers out there, or ultrasound. Actually, ultrasound skin tightening is a thing too. So I think the best treatment plan is multimodality.
Okay.
That's expensive.
Mm-hmm.
So it's also really important to know when the things within your med spa, even though you may be pressured to sell them
Mm-hmm.
at times, depending on where you work, when they're just not going to be it and when to refer to a plastic surgeon.
Okay.
So eyes specifically, like excess lid tissue is truly that's a call to a surgeon.
Mm-hmm.
You can do
I'm headed
yeah,
that way.
you
Yeah.
can do a lot of
Okay.
you can do a lot of brow lifting with either neuromodulators or like skin tightening devices up here.
Mm-hmm.
Mm-hmm.
And you can actually laser some of the lid tissue if it's more of like a laxity thing, like
Mm-hmm.
you pinch it up and it kind of takes a while to go, or you've got this texture. But
Mm-hmm.
if it's a fat pad, which most of the time that's genetic,
Okay.
or your fat pad herniates here, or you have eye bags down here,
Mm-hmm.
that's a surgical intervention.
Okay. Good to know.
And a lot of people, push it off as long as they can,
Mm-hmm.
but eventually, knowing who the referral people are in your network that are trustworthy and their work.
Mm-hmm.
That's why like a trusted injector can get you to the other trusted people that you need.
Yes.
That's great.
Yeah.
Yeah.
Because I'm headed in that direction with these eyes in the next
Well,
year or
How are we
two.
going to see, Pam?
we'll get you there, girl.
What about the jowls that for some reason in the last 2 years just went psh?
Yeah.
These are easier for us to manage in a med spa.
Oh,
Okay.
really? Okay.
So what happens in your late 20s actually is this mid-face volume starts to change.
So
Mhm.
that early.
That early.
Wow.
We
Okay.
know that because we have anatomists that just study the face.
Huh.
And I've been fortunate enough to do cadaver labs and have lots of trainings with anatomists. And these fat pads shrink and descend. And this is the only fat pad that grows is the buccal fat pad.
Mhm.
And that's what makes a gel, right? So
Yeah.
if you can do anything to maintain the mid face,
Mhm.
that's always going to be step one.
Okay.
If you complain about a gel, and someone just tries to build you like a Jay Leno chin or a big jawline without correcting anything up here,
Right.
Yeah.
it's like
What are the options
that's
for that?
buying bigger pants.
Yeah.
That's not buying skinks,
Right.
right? That's
Yeah.
like, or like a booty bump. What are those,
Yeah.
inserts that you can get?
Yeah.
Right.
Yeah.
That's not the answer.
No.
Gosh.
So we always want to start with like a top-down approach.
Okay.
And this talk is about Botox, right? So there's all of these lower face muscles that tend to pull down
Mm-hmm.
that you can often, with more of a low risk, try to inject them to get lift to see the illusion of what mid-face volume correction would be.
So you can do that with like Botox or
Wow, there's
okay.
a muscle. This platysma
Mm-hmm.
has a superior portion that you can't flex, but it pulls down and just inserts this skin on your jawline.
Okay.
So generally speaking, any neuromodulator does the opposite of what the muscle's function is.
Okay.
So if it pulls down, you could get a little lift.
Oh.
So that's always a good place to start before you start getting into filler if you're just worried.
Okay.
Yeah.
All right. So then that goes into volume loss or hollow cheeks, which, I think we see a lot lately with people losing a lot of weight really fast.
Mhm.
But I'm assuming it's kind of the same answer then, or no, filler?
It's the same answer, but the best investment and the most natural result, most long-lasting result is going to be a biostimulator.
Okay.
So that's either Sculptra or Radiesse. There's something called PRF or PDGF, which are growth factors, but I think they're less predictable. Sculptra and Radiesse are made and were studied in HIV fat pad facial atrophy.
Okay.
And can you tell us a little more about Sculptra? And is that the one that regenerates the collagen?
So Sculptra is a biostimulator and Radiesse is a biostimulator.
Okay.
They're two totally different ingredients that create this new tissue. So Sculptra is polyl-lactic acid, which is dissolvable suture material.
Oh, okay.
Think about that acting as a fertilizer in your skin, deep down to bone in certain areas. It's going to rebuild that scaffold of the skin.
Mm-hmm.
It makes collagen and some elastin.
Okay.
Radiesse is different. Radiesse is calcium hydroxylapatite, which is what our bones and our teeth are made of.
Oh.
And so it follows a slightly different pathway to make collagen, elastin. It does regenerate hyaluronic acid. It's more regenerative than biostimulatory, which sounds the same, but it's a little different. And I don't think either is a wrong choice. I think it depends on what your anatomy is and what you need.
Sure.
I think Radiesse is a little more versatile if you need more discrete volume replacement. Like say you were really sunken and you needed more under eye support, which we get from the cheeks. I could keep the Radiesse a little bit thicker and like put a little bit there and then thin it out and then do it more diffuse. But it's like fertilizer for your skin.
Okay. Wow.
So with both of those, it's also not an instant gratification thing.
Okay.
So it takes 6 months to mature that collagen, regardless of the product. So that is also, I trust you as my injector, that I'm not necessarily getting instant gratification. I've spent all this money. You've done this whole big thing with needles in my face. Okay. And so it's really hard to jump there with a new patient, but I do often.
Okay.
And I think people appreciate that it's a solution and it's your body making a result rather than just a temporary fix.
Yeah.
Okay.
Yeah.
So then is that the same well, it's not the same, but would it help also with, I've got this double chin as I get older, it's just like falling. Same thing.
So where would you lift if you were like, I wish I just.
Right. Well,
right.
I just need like,
the fan or like lay back in like the beach chair position.
Right. Just, just like that.
What was the question?
What do we do for this? How do you fix this double chin?
Yeah. No, this is it. What I just said.
Yeah,
Okay.
same thing.
So
Okay.
the way that you lay those products down,
Mhm.
Okay.
you have to think of like vectors of where you would get a lift for a facelift,
Mhm.
right?
Okay.
And so if you stimulate the collagen and the structure there
Okay. It all
first,
kind of,
it can pull up downstream.
okay.
Wow.
Great. Okay.
And I've been doing these things, so my face doesn't really move that way. But I think that's also the reason why more people should talk about it.
Yeah.
I have a lot of women come and they're like, "Oh my God, I'm turning 40. I have 3 kids. I've never done anything for myself. I just did a GLP and I've lost this weight and now my face fell off." And I'm like, "We got you."
Yeah.
There's things, but
Yep.
there's a lot of more preventative steps to take before you have so much correction that
Mhm.
in the long run will also save you downtime and money and
Well, that brings up a question. If somebody is starting a GLP-1, because they're pretty popular now, do you suggest that in the beginning of this journey, they go ahead and see you guys so that they can prevent this, you
yeah.
know?
Well, I'm very well positioned and a lot of med spas are offering wellness services. So it's like my same patients that me as the nurse practitioner, I can manage their medical weight loss
Mhm.
and also be seeing them regularly for their face.
Mhm.
Yeah.
But typically, go low and slow and don't lose weight so fast. And so, if you want to lose 40 pounds, which is like amazingly so achievable with tirzepatide and semaglutide and all these new drugs to come,
Mhm.
Mhm.
that should take you at least 6 months,
Mhm.
Right.
if not longer.
Right.
And so, before you start to really see things happen, I would say for sure consider these biostimulators to just keep it nice and tight.
Okay.
Okay. Gotcha.
But
And then
everything's expensive. I mean,
Yes.
everything. Yes,
Yes.
it is.
and if you have an injector who doesn't respect that, leave.
Find somebody else.
That might
Yeah.
be the big takeaway is like if you feel like you are not respected in all the ways you need to be respected and financially too, like it's a red flag to me.
Yeah.
Okay. And then something totally different, large pores or uneven texture.
So, one neuromodulator, Daxify, has a peptide in it, which has been shown to improve skin quality,
Okay.
That's the one I was
specifically in
thinking
that
about,
T
Lauren.
zone.
Yeah. Yeah.
Mhm.
But that is much more skincare and facials and microneedling
Okay.
and treating the skin,
Okay.
not necessarily the underlying
The
muscles.
muscles.
Okay.
But pores are genetic.
Mm.
So if you have big pores, you just want them to be decongested and as small as possible, but they're genetic.
Okay.
Okay.
Mm.
And any other top concerns or treatments that we haven't discussed that you highly recommend?
I have suffered through my 2 pregnancies with melasma.
Mm-hmm.
And I have been very regular with my skincare, used all of the topicals that I could have to try to control it, and it just would not budge. And so I embarked in the laser realm for myself. I'll be 35 next month.
Mm-hmm.
And so I'm done having children, which is awesome in a lot of ways by
Really? Because
choice.
mine gave me these and these and
Done with
these.
children by choice. And so I feel like investing in those lasers to really get rid of that one thing that I just could not do otherwise
Yeah.
made such a difference. But it made such a, future impact on my collagen. And it can also
Huh.
help change the gene expression of future skin cancers.
Oh.
Wow. Okay. So,
So I did a Moxie, but BBL Moxie is a brand of lasers. And you do these things for aesthetic outcomes, but if they serve you underlying medical benefit and they're studied that way, like it just makes me feel like I'm doing all of these very proactive things, like an
Right.
IRA from my face.
Yeah.
okay.
So I
So
would
get
not
lasers.
sleep on the laser game. Yeah.
Okay.
It's really hard to find downtime. And
Well,
those are
that,
really
Yes.
downtime
right.
procedures.
And I think that was the biggest issue for me, but I've just got to find the time and do it. So
Yeah. Yeah.
And I feel like this should be a follow-up episode because I'd love to
Yeah.
delve into that too.
maybe we'll record next time I get
Yeah.
a treatment, and that'll
I
be on.
know.
Yeah. This is the follow-up.
Yeah.
All right, before we wrap up, we're going to switch gears a little and do a quick rapid fire. We're going to throw out some products and treatments, and you give us a 0 to 10, 0 being absolutely not, 10 being yes, and go for it. And if you want to give a quick reason why, you can, or just give us the
Okay.
0 to 10. Okay, so the first one is icing your face.
Why not? 5, because I would not ice it if you don't feel like you need to ice it, but I think
Okay.
it can't hurt.
Okay, great answer. All right, the one that we touched on earlier, beef tallow for skin.
I'm gonna give it a 0, and some people might push back. It's better suited for French fries. It's not all made equally. It's largely comedogenic. If you're vegetarian, it's off the table. So I would not blanket recommend it.
Okay, derma roller.
This is like an at-home microneedling tool.
Mhm.
Yeah.
Mhm.
I would say no. I think you could introduce bacteria. Bam! Okay, let's give it.
In all fairness, I did just get it, so I won't use
This
it.
is a highly educated listener population of people that have worked in medicine, right? So I do trust like aseptic technique a little bit more
Yeah.
Okay.
than like the common person on TikTok, but you never want to introduce bacteria in your skin and put you at risk for infection.
Okay.
You don't actually want to like microderma roll anything in that's not supposed to be microneedled into the skin,
Okay.
because you can cause, granulomas and scar, and I just wouldn't.
Yeah.
Fair.
But I do think that there's probably some good tools out there for the right people.
Okay.
But again, if you want a result and you invest in a professional doing a, professional treatment, you'll probably get more of what you want.
Okay. Gotcha.
4.
Okay. The next one, the gua sha.
I think gua sha is great.
Okay.
I think gua sha requires a glide.
Mm-hmm.
So you're not, hurting your skin through this
Mhm.
physical exfoliation. But
Right.
I think you could actually learn how to gua sha from TikTok in a decent, meaningful way. So let's give it like a 7.
Okay. At-home red light therapy, mask or other devices like Medicube.
I have an Omnilux.
Okay.
I don't think that there's one perfect brand, but I do think red light therapy has tremendous benefit for a lot of things. So I would give it an 8.
Okay. PDRN, and I'm going to try and say this, but I'm going to butcher it. Polydeoxyribonucleotide.
Do you know
Is that
where a
even
lot of,
close?
okay, let's give that like a 6.
Okay.
Do you know where that comes from usually?
Mm-mm.
Like sturgeon sperm.
Oh.
So they're growth factors derived from this fish typically. And I might be totally wrong, but all of the PDRNs I've seen are derived growth factors from
From
sturgeon.
okay.
There are PDGF, which are platelet-derived growth factors, which are from humans. And if you're a human, I would assume you would want human growth factors to get the best result. And so in comparison to PDGF, which I'd give an 11 out of 10, I would give that like a 7 as well.
Okay.
These are all like add-on topical treatments when you have some sort of injury for it to infuse into your skin. Sometimes there's like topicals, but it needs to have a driving factor, which is probably an alcohol. And we're getting into like how to inject these for regenerative properties too.
Interesting.
Okay. Retinol or retinal? Is that how you say that?
Retinal.
R-E-T-I-N,
So the
retinal.
retinal.
And can you mix it with vitamin C?
Retinal sounds fancy. Would be like an over-the-counter. So retinoid, retinol, there's like derivatives of such too, would just be that like vitamin A derivative. So vitamin A helps with cell turnover is like the ABCs of skincare. It's the A. So
Okay.
I would say as long as you tolerate it and it's not inflaming your skin,
Mhm.
8 or 9 out of 10.
Okay.
And
Okay.
you should also use vitamin C, but at different times. So the
Okay.
vitamin A should be a nighttime thing,
Okay.
a retinol for repair, and a vitamin C should be in the morning to prevent you from free radical damage.
Okay. All
But
right.
all vitamin Cs are not created equally.
Right. Okay.
I'm soaking this all in. So
Very complicated. Maybe I should have a
yeah.
TikTok.
You should.
I think
You
so.
would do
I'd
great.
watch.
You would do
Yeah.
great.
Yeah.
All right. Cool sculpting. Yeah.
We'll move
I've
on.
done.
Just get on a GLP. You could Google cool sculpting shark bite. I would give it a 2.
Yeah, I've had it done.
I think in specific targeted areas, it's fine. I think we have moved on from cool sculpting.
Yeah, well, I did it back when it became popular.
Yeah.
It did a little good for a very short amount of time, and then it was like,
It does no tightening. And I think what we all really need is tightening.
no. Yeah. Yeah. Anywho.
Anywho.
What about NAD?
I think NAD is great. I think NAD is like a 6.5.
Okay.
But I think it's more nuanced and you have to have a lot of other things in line before you consider NAD for your wellness.
Okay. Monthly facials.
I wish. I mean, if I'm quarterly able to get on a chair.
Well, that's a question. How often should you have facials?
I love them at season change at minimum.
Okay.
So like
Okay.
after winter when you've got all this dead dry skin, after
Yeah.
summer when you've got all this sunscreen that's like built up. So twice a year, 3 to 4 times a year if you can. I think monthly is sometimes too much.
Okay. All right.
But 10 out of 10 if you can. I mean, I would love to get a facial.
All right. What about preventative Botox in your 20s? We'll say early 20s because you already said probably late 20s you should start. But
I don't think preventative Botox should be a thing.
okay.
And I'm an injector. I think it should be when you need it.
Okay.
You start from seeing those lines.
Yep.
Mhm.
Yeah.
Yep.
And then the last one, microneedling and lasers.
10 out of 10. 11 out of 10.
Okay. Noted.
Yeah.
Yeah. And
Star,
like
star,
really,
star.
unless your injector is also performing those procedures, which sometimes they do, I would love to. I just don't have the bandwidth in my practice. It's me sending the business away from me
Mm-hmm.
because that's the best thing for you.
Okay.
My injections will look better if you do those things
Okay.
because your skin quality is going to be that much better and stronger. So
Okay. So we're helping
Great.
each other out at this
Wonderful.
point.
yeah, this is a team effort. Okay.
Right.
Women are in it together.
Mm-hmm.
If you're
Yes.
not, we might not want you to be.
Yeah.
But generally speaking, we're together in this.
Yes. Agree.
Yeah.
Well, thanks, Julia. This has been so helpful. And honestly, I think it takes a lot of the fear and confusion out of something that can feel really overwhelming at first. I love the message really comes back to starting simple, making sure you ask those questions and making sure, the decisions feel right for you individually. So I guess if there's one thing we hope people take away from this conversation, it's this: taking care of your skin doesn't have to feel overwhelming. And it definitely doesn't have to be all or nothing. It's all individualized.
Right. Start with the basics, ask the questions, and make decisions that feel right for you. Whether that's skincare at home, treatments, or nothing at all, just remember you have options.
Yeah, and feeling nervous or unsure about any of this, it's completely normal. And the key is finding someone like Julia who you trust, who will educate you and not pressure you.
Julia, thank you so much for being here with us today and for making this feel so approachable and honest. We loved having you today.
Well, thanks, you guys. Thank you for having this platform and doing what you do and sharing so much cool, needed stuff with the world.
Yes.
Awesome.
Absolutely.
And if any of our listeners want to learn more from Julia or follow along with what she's doing, you can find her on Instagram at detoxskin_julia.np. I'll also tag her in our post as well as add her information to this episode.
Slide into the DMs. No question is off limits.
Yes.
Seriously.
That's awesome. And to everyone listening, if this episode helped answer some of your questions or made you feel a little more confident, make sure to download, subscribe, and share it with someone who's been thinking about this too.
And we'd love to hear from you. Message or email us and let us know what's something you've been curious about, but maybe a little hesitant to ask when it comes to skincare or treatments. We can bring Julia back on.
Yeah. 2.0.
Pam knows where to find me.
I do.
I'm happy to help. Seriously. I think, teaching other people what you know is part of just life's mission for me. So I would love to go back anytime.
No gatekeeping. Love it.
No.
Love it.
Girl power. No
Yes.
gatekeeping.
Yes. Well, thanks for hanging out with us. Everybody else, go grab yourself some more coffee. Take care of your skin, and we'll see you next time. Bye.
Bye.
Thanks for digging into the Scrub Bin with us. If you enjoyed today's episode, hit follow so you never miss what's next. And as always, stay real, stay kind, and stay curious. We'll see you the next time. Bottom of the Scrub Bin is a podcast produced under SafeQ Solutions, LLC. The views shared reflect our personal experiences and perspectives and are not intended as medical, legal, or professional advice, nor do they represent the views of any client or partner.